Peace be to you. Assalamu alaikum. This is Omar Abdul Malik, physician assistant and health educator. I hope you guys are enjoying today. Today's Wednesday, the 12th, as of the shooting of this video. I'm here in Washington, D.C., doing my 10-mile run, or in my case, very slow jog. I wanted to talk to you guys, give you guys a follow-up on how I'm doing. I took the my first shot of the Moderna Covid-19 vaccine. It's been about 48 hours, and sorry. And it's been about 48 hours since I had the vaccine, and I feel good, you know. I don't feel fatigued. I didn't get any shaking chills or anything like that. Unlike some people have had reactions of varying degrees. My arm is a little sore, but I get that with the H1N1 vaccine and influenza vaccine and the pneumococcal vaccine. So there is some swelling, some edema. That goes about 2 centimeters in diameter. But I wanted to, I got some trolls. I did a video of myself getting the vaccine. I had some people troll me. Why are you doing that? You know, you're leading credence to this pandemic, this falsehood. Other people suggested I was getting paid. I wish I was getting paid for Moderna and Pfizer. I definitely cut down on my work hours. Yeah, I'm not getting paid. I don't know if this is a pandemic or not. I don't know who's making money on these vaccines. It's Bill Gates. Bill Gates is a multi-billionaire. He doesn't need our money. But I usually don't get angry about these things. I usually delete trolls, or if they're not being too pugnacious, I'll let their comments stay for a bit. But I got ticked off because I admitted a couple of patients. I did night shift a couple of nights ago, and I had one patient who's got metastatic carcinoma. It's a really sad case. She's about my age, in her 50s, all over her body. Very, very poor prognosis. White blood cell count is very low. So that's something called leukopenia. And that's where you've got massive destruction of the white blood cells. And I'm sorry for those of you guys that are alternative medical healers. If you think there's a cure for that, be my guest to subject people to it or invite them to it. Because I'll say this as an allopathic trained clinician. You know, the cures often tear people's bodies up as much as the cancer. So if your herbs and stuff help, or your positive crystal therapy or whatever, if you think that can help, by all means contact me. But this lady has almo's no immune system, and I had another patient who I admitted who is an elderly woman. She's got poorly controlled hypertension, diabetes, chronic renal failure, on dialysis, infected decubitus ulcers, bacteremia, which is a blood-borne bacterial infection. Another person, she's at high risk for getting all sorts of stuff, not just nosocomial infections that people can get for prolonged hospital stays, but just stuff that comes from me, whether I have a bacterial infection or viral infection that I don't know about. And it's for these people that I got vaccinated. And I don't want to disregard people's opinions or their deeply held beliefs. I was talking to one of my colleagues that's a devout Christian, and we were talking about the concept of the mark of the beast There's people who are convinced that the vaccine is the mark of the beast. I don't want to be derisive toward people's political beliefs or religious beliefs, or just beliefs in general, no matter how inane I may feel, no matter how vehemently I may disagree with them. I think everybody's got a right to an opinion. With this caveat, if you don't have the responsibility of accountability, as I talked about in one video, it's just an opinion. Your opinion doesn't really affect those around you to as great a degree as somebody who's directly responsible for rendering care. Like, the nursing assistants at our facility have gotten the vaccine. And patient care technicians, they're working very closely with the patients. They got to clean them off, turn them every 2 hours, feed those who can't feed them. So they're intimately involved in touching the patient. And so these very high risk patients. So I was talking to some of them like, yeah, I got my vaccine. And so sometimes it's not so much about protecting yourself as it is protecting others. And somebody called me a fool. Yeah, I'm glad I'm not a fool. Well, this anonymous troll is probably not responsible for taking care of anybody. I mean, just imagine if I go into the hospital and I'm asymptomatic. Like, I get the sniffles now because it's just cold out here. It says it's 30 degrees, but it feels like it's in the teens. But I know I've got a very healthy immune system. I had blood work done. My white blood cell counts are within normal limits. I don't have leukocytosis indicating any type of infection. And I think if I got COVID, I think I'd be largely asymptomatic or low symptomatic. So imagine I go into the hospital and work with these patients, and I give them COVID. Our patients get screened for COVID-19 before they come to the hospital. Now just imagine if they get COVID from me, the one who's supposed to be rendering or managing their health care, and I kill them. I don't want to live with that. I don't want to be accountable for that. So that's why I got the vaccine. And, the anonymous silly trolls who I don't think have taken anywhere near the amount of science that I've taken. I had to spend years and years in school. I got a bachelor's degree in biology, another bachelor's in physician assistant, a master's degree in PA studies with a specialization in infectious disease, a doctorate of health education. I've published original research in the field of infectious disease and health education. You could just Google my name. You'll see it there. And it's not very robust research, but I did something. I think that I have earned the right to have a say. Not that anybody else doesn't, but say, listen, I can speak as an authority figure on this. And for those of you guys that are trying to become physician assistants, you're pre-PA, or you're actually in PA school, you're going to be burdened with this responsibility also. Don't think because you're not the doctor that your words don't count any less, man. They carry weight. Yeah, I talk to the families and they ask me, well, what do you think, Doc? How's my loved one going to do? What's their prognosis? How's the outcome? And I talk to the patients about it. It's a big responsibility that carries a heavy burden. So I'm going to do some more videos about how much time do I have? About the vaccine and what constitutes a vaccine and actually what's in it, because I'm talking to people that are actually doing the research, not the conspiracy theorists. Anyway, I wish you guys the best of success in your positive endeavors. Pray for us or send positive energy for us here in Washington, D.C. We're going through a lot. All right, take Take care, guys. Peace.